Well, I'm going to go ahead and get us started. I'm Andy Lewis with University of Wisconsin Extension, and I work at the Center for Community and Economic Development. And it was a little awkward in that I was on the planning committee. I had suggested this session and then quickly got recruited to be on the planning committee. But I did want to set up this session. I think we've got a really interesting discussion on the efficiency of healthcare and healthcare as a value proposition for Wisconsin. I started working with the Wisconsin Hospital Association, I think back in 2008, with Steve Deller, economist on campus, looking at the economic impact of hospitals. We don't just do economic impact studies, we do economic impact studies that we think are going to be relevant and where the information can actually be applied to solutions. And this one felt kind of like a no-brainer. And if I could just tell a couple of stories. I've always looked at healthcare and hospitals, and I think this is a tendency of most people, as a quality of life asset for the community. That when my wife and I were young and were thinking about starting a family, and we'd had a bad experience with a miscarriage, largely because of a blood test that should have been run, not a hospital error, but a physician error. And we were starting to look at communities where we could actually raise a family. I would not have lived in a community that didn't have a hospital, and we chose Lancaster. And at that time, Lancaster Hospital was actually a municipally owned hospital. And I told Jerry Worley I was going to tell this story. But an incredible asset. That's one of the reasons why we chose to live in Lancaster. And then as I've aged and had to take care of aging parents and an aging self, hospitals again is a really critical asset to most of our communities. And then from an economic standpoint, we know that hospitals are a major contributor. It's in 44 of the 72 counties, it was a top 10 employer. And so in the communities that you're working with that have hospitals, you probably know that. But a lot of people take that for granted, or they really don't think about it. 63 of our 72 counties have at least one hospital. So it's an asset that's in most of your communities. And if there's one thing that you walk away with today, I hope it's that as economic development professionals, you know two things, that there are a couple of assets in the room that can help you. The Wisconsin Hospital Association can help you put together your case for healthcare and hospitals as an asset to both your workforce and your employers. And then Russ Cation is an incredible resource for helping you figure out economic impact analysis. Before I launch into one other slide, I think this would be a good time to do introductions. I'm joined by Ahrq Borgerding, who is the president and CEO of the Wisconsin Hospital Association. Ahrq's been with WHA since 2002 and has held positions as vice president of government relations, senior vice president, and executive vice president from 2007 and 2015. Some of you may know of Ahrq from his work in 1997 until his return to WHA, where he served as the director of legislative relations for the Wisconsin Manufacturers and Commerce. Ahrq also served as the chief staff lobbyist for the University of Wisconsin-Madison under Chancellor David Ward, and he was the director of legislative affairs for the Wisconsin Hospital Association from 92 to 94. There's a lot more that I could say about both of these individuals, but that gives you a flavor. He's not a Red Sox fan if you listen to the previous presentation. Professor Cation has conducted an extensive research in financial institutions and published in a wide variety of journals. Russ Cation is a professor of economics at the University of Wisconsin-Whitewater. He also serves as a specialist for the University of Wisconsin Extension and is co-founder and director of the Fiscal and Economic Research Center at UW-Whitewater. He's attracted over $450,000 in contracts with local nonprofit organizations, government units, and businesses to conduct economic research. And it's amazing the kind of work that Russ and his shop can do for small amounts of money, so consider him as a potential resource. Russ has done studies varying from the economic impact study of potato growing in Wisconsin to looking at the foreclosure issue in Wisconsin. So he's been a great resource, and you'll hear from him shortly. Today's presentation is really focusing on not the cost aspect of healthcare and also not the great outcomes of healthcare, but really looking at healthcare from an efficiency standpoint, the way the last presentation ended. That's what we're going to share with you today, along with a general discussion about healthcare as a value proposition and an asset that we can actually promote in Wisconsin to our employers and our workforce. One of the interesting things when we started this analysis, the first thing I started thinking about was, I think in Wisconsin, and this map would kind of bear this out, is that we're fortunate that we've got hospitals distributed across the state. You don't have to drive long distances for the most part to get health care in Wisconsin. And it's kind of a Midwest phenomenon. I mean, there's pretty good distribution of hospitals in the Midwest. But if you look at some of our competing states, if you look at the West, for example, you could see that you could live in parts of that state and have to drive hours to get to a hospital. So there was part of me that thought that, well, maybe there's a trade-off to having that easy access to hospital, that there would be less efficiency in delivering healthcare services. And that turned out to not be the case. And with that, I think I'll turn it over to Russ to present that argument, and then we'll hear from Ahrq after Russ. No, you're next.
Good afternoon. I'm actually impressed. We were taking bets on the way in how many people would stick around after lunch. And so I think I lost the bet. That's how negative I am, I guess. You know, it's a dismal science economics. So you have to live with that. I brought along two of my students who basically the Fiscal and Economic Research Center conducts studies on a wide variety of things. I mean, you'd be surprised at where we put numbers on things you wouldn't think numbers belong. And the people who do the analysis tend to be undergrads from the University of Wisconsin-Whitewater's. Last year we produced, from this work, $650,000 in college scholarships for graduate school. And our students published last year 5 articles in peer-reviewed journals, and we expect to publish this. Patrick is a graduate student. You can stand up, Patrick. And he's from Columbus, Wisconsin, and he'll be finishing this summer. And Derek is an undergrad, and this morning he got a call from the Richmond Federal Reserve Bank to interview as an analyst there. And so we have great students in Wisconsin. And I will say this, in 2003 I was chosen as a Wisconsin IDEA Fellow. And I do believe in taking the resources and assets of the university and making them available to the public. And so we're there for you. What we were asked to do is look at the technical efficiency of our hospitals. And if you have a pen and you have a piece of paper, if you want to write on the tablecloth, please. I'd like you to write this down, 2 equals 1 plus 1. Let's write that down. I'm a professor, by the way. If I had a whiteboard, I'd do it here. And then write down 2 equals 1 plus 2. What technical efficiency says is, what is our output? How do we assemble our inputs to create this output? If we think that our output is quality of health care, and we measure that, that's what we do, that's 2. And that 2 is created by having capital and labor. We're not talking costs. We're talking, what are our inputs? Our inputs are workers. Our inputs are MRI machines, hospitals, beds, those types of things. So if you have 2 equals 1 plus 1, you're more efficient than 2 equals 1 plus 2. Because what you have to have is a minus sign of 1 at the end to explain why we're in disequilibrium. To cut to the end, Wisconsin, in our calculations, was the 3rd most efficient state in the provision of health care through the hospitals. And we did this by looking at technical efficiency. exists when the output of healthcare is maximized given existing inputs. We have inputs, we create quality healthcare. Our inputs in our case were basically the percentage of the labor force in healthcare, and we control in a way for the age of our population, because we have a lot of people in Wisconsin who are elderly, and how many hospital beds. Because how many hospital beds is an indicator of the capital investment we have in our hospitals, because hospital beds are correlated with those other capital goods that we provide, and we don't have to go square footage of hospitals. We could, but we get the same results. The efficiency of healthcare can provide a major driver that could attract or repel economic development. That's why we're here today. I was listening to the earlier speech, and it was very interesting. The $4 with Walmart drove this home. Walmart is charging their employees, I love the word associates, $4 to visit the clinic. They're charging the public $40. They're in effect probably subsidizing their employees because they want healthy, somewhat happy workers. That's why they're charging $4, because they want them to show up to work and be productive workers. The efficiency of healthcare can provide a major driver that could attract or repel economic development. An efficient healthcare delivers better outcomes, has higher quality, and makes care more accessible. More than 2/3 of employees, hopefully this continues, are covered by employment-based health insurance. Healthcare quality influences healthcare employee health, which influences worker productivity. And that's where it comes down. It's about worker productivity. We want that number to stay high, to recognize that worker productivity is important. We have inputs, capital, and labor. We get an output. Our output is quality care, access, and health outcomes. We basically say that these measurements should be relevant, they should be feasible, and they should be well behaved, which in effect get to the end of the story. When you run the regression and you run it again, you better get the same results. And sometimes you don't. Sometimes you have unstable data. We have healthcare quality, we have healthcare access, and we have employee health outcomes. And we measure this through a 10 scale. The healthcare quality comes from a 10-item scale from the quality survey data, in which they survey former hospital patients as to their experience. And one of the questions is basically, did they give you instructions on the medication to take after you left? Was the hospital clean? Well, these lead to better health care, because I think if you go to a clean hospital, you're going to probably be healthier. Healthcare access, we use the data on the adult insurance coverage. And this is, by the way, a relative study. It's comparing state to state to state to state. Wisconsin versus Illinois versus Texas versus Iowa versus California, Hawaii. And so it's relative to other states. When I basically say Wisconsin's efficient, it's relative to other states. A person could get up in the crowd and said, all healthcare is inefficient. It's a relative issue. It's kind of like, what was it, the NFL South, where the team that won was 6-10? Well, they were basically all inefficient, but one was more efficient than the next. The Census Bureau, the employee health comes from 10-year survival rates. After you go to the hospital, how long do you live? That's how we measure whether your health care was successful. Capital, beds per 1,000, proportion of full-time equivalent employees in the healthcare industry. And we'll get back to costs. The states that we found were most efficient are in the upper right-hand corner. Iowa Wisconsin, Minnesota, Massachusetts, Maine, Vermont, New Hampshire. Upper right-hand corner says they had great outcomes, health outcomes over here. That's the dependent variable. That's the outcome, the left-hand side. Technical efficiency said, how do we mix these inputs? The way Hawaii becomes efficient, they're the number one most efficient, is they mix their inputs well. Did they get a great output? No. Their output's about 10% less than Wisconsin, the quality of their care. That's one way you can get great efficiency. You can be the Pittsburgh Pirates. You can put very little money in and get very little out. And that's one way to be efficient. I prefer to be efficient by getting great outcomes. And if you see those states, and by the way, Iowa, Wisconsin, Minnesota, Massachusetts, Maine, Vermont, I'm going to go back just for, don't get dizzy on me here. There they are. Those are the states that provide hospital access. It's a great slide. We're going to integrate that in the next version of the report. By the way, the states over here that don't have hospital access, we don't have them in our grid. We don't have them in that beautiful slide right there. Because it's not our goal to criticize the other states. Our goal is to amplify the great things that Wisconsin does, the great quality of health care that we have, and the efficient mix of the inputs that we provide. When we were asked to do this, we had seen a similar report from the Commonwealth Fund on health system outcomes, and it was very similar. You can see the states that had the best performance, and we'll get back to that. And those were the states that, by the way, had great outcomes in terms of their efficiency. The mix of products, of the inputs they give, are very well handled. Wisconsin is number 3. If you have a comparative rank, we're at, and I apologize to those of you who need binoculars, we're at 93%. No one's at 100%. But if you look at Hawaii, Hawaii's at 94%. But Hawaii's at 94% because they have less quality, but they have even vastly less inputs in terms of employees and capital. Cost efficiency, we came in 11th. We pay for it. I mean, there's no one in this room who's going to say, well, we're technically efficient, we're 3rd, we're the best, we're cost efficient, we're 3rd. No, Wisconsin pays. I will, for full disclosure, I appreciated that comment. My wife is a radiologist with Aurora. When we got married, we've been married for over 30 years, I said I would never do healthcare economics because I didn't want to cross paths with her. I don't do healthcare economics, I build models. My background in doing this comes out of finance, where in finance we look at the efficiency of banks. We say what banks are most efficient, which ones make the most profit given their inputs, loans, deposits. What does the bank balance sheet look like? What's the health balance sheet look like? It looks like that. It says the quality of care comes from the assets we employ or deploy to get there. Wisconsin, we pay a little more. We did a little test, and it's not, I wouldn't say it's the most realistic test, but if we were to decrease our cost of health care in Wisconsin, by 1%, we'd move to 10th. By 2%, we'd move to 9th. Is it realistic? Probably not, because if we reduced ours, the other states would probably reduce theirs. If everyone raised theirs, we probably wouldn't be able to stand stable. But if we were able to hold our cost structure stable while everyone else raised theirs, that's how we become more efficient. We have two ways to become more efficient. How do you become more efficient? Better health care or fewer inputs? Which one do I prefer? As a patient, I'm a patient, I don't work in health care. I want better health care. The other way we improve efficiency, my wife will regret I'm going to say this, is you employ your assets more. You're better. You have your healthcare workers work harder, faster, better, smarter. That's where it is. In many of these cases, we have similar inputs, the similar number of healthcare workers, the similar number of beds, but our output is superior. That is a reflection of harder, faster, smarter, better. That's what it's a reflection of. It means that our inputs are better. We have the same number of healthcare workers, we have the same number of beds, but we get a better output. That's where it's coming from. When Ahrq finishes, I'll be available for questions too. Do I have to pass off?
Yeah, I guess so. Okay, thank you. Pardon my voice. I did not smoke 2 cigars on the way over here, though I do like a cigar every once in a while. I've got this cold, and it's probably a good thing I'm the last speaker, so I'm going to infect the microphone. But good afternoon. My name's Ahrq Borgerding with the Wisconsin Hospital Association. Very, very pleased to be here today at this program because it really is an opportunity to talk differently, I think, about health care, and differently about health care in particular in Wisconsin. And what do I mean by that? Well, this is a report, the cover of a report that we did in 2011 with the help of UW Extension that really it was your typical economic impact report. It talked about jobs in healthcare. It talked about the ripple effect of those jobs in healthcare, the tax revenue generating impacts of the healthcare industry in Wisconsin. All things that said we employ a lot of people and we generate a lot of economic activity. Okay, that's great. But when we started thinking more and more about the role of healthcare in a state like Wisconsin, we really started to leave this information behind. Not that it's not important, and not that we won't be updating that report very soon. But we really wanted to start thinking more about what does healthcare mean for the non-healthcare sector? What does healthcare in Wisconsin mean when it comes to bringing healthcare, new employers to this state? What does healthcare mean in terms of helping employers locate, help them determine, is it a factor in that calculus that helps them figure out where they're going to locate, where they might expand? We wanted to think about healthcare in a different way because I think we have a lot of good things going on here in this state and things that we should be talking about from an economic development perspective. And again, not jobs in the healthcare sector, but how is healthcare in Wisconsin affecting in a positive way, or how can it affect in the positive way the decision to locate a new business or a new company? So we actually surveyed 300 employers in Wisconsin a few years ago and asked them to tell us what is important when you're thinking about where you're going to locate or where you might expand. And we were surprised. Education, number one. Taxation, business climate, everyone, of course, thinks of that all the time. Workforce training and development, of course. But healthcare. And it wasn't just the price of healthcare, which is obviously a crucial issue, the sort of upfront price of healthcare. But what does healthcare mean for the productivity of my workforce? What does healthcare mean for the quality of my workforce and the efficiency and the effectiveness of my ability as an employer to manage one of those costs of doing business in this state? And that is not just the sticker price, if you will, of healthcare. It's what's also the downstream benefit of good quality healthcare in a state. And that really was enlightening to us, because it helped us understand what the language, if you will, the message that we needed to start thinking about in terms of helping our state grow its non-healthcare economy. Healthcare, the healthcare sector, absolutely needs a healthy and thriving non-healthcare sector. And so what is our role as healthcare providers in helping you grow? And so I think you saw this slide already, or at least briefly a little bit. We started to think about healthcare differently, as I've already said. But really, we think about it in terms of value. What is the value equation of healthcare? What is the bang for the buck? What is the return on investment in the dollars, both short-term and long-term, and for the dollars that employers in Wisconsin are spending on healthcare? And it's really a combination of both quality and cost. And we already saw the results of one way to look at it in terms of efficiency of output, but there's other ways to look at this also for a state of like Wisconsin. And then also, how can we take that? How can we take this thing that we've been talking to each other, but when I say we, I mean the healthcare industry. We talk to each other all the time about improving quality and improving value and improving results. And that talk that we do amongst each other and that sharing of knowledge and information has produced a consistent sort of improvement in quality and output and outcomes. But now it's time for us to start talking about this as it relates to other aspects of our economy. And how can we use that to help the state grow? Saw this already. I won't spend any more time on it. I'm definitely not an economics professor or a mathematician, though I went to Whitewater briefly, and my son went to Whitewater till he transferred to Madison and had a great experience there. Much more one-on-one contact with professors. He came to Madison because he wanted to come to Madison. I don't think he's seen a professor since. But I guess I probably shouldn't say that right now, given all the stuff that's going on with the budget. Anyways, another measure of quality that we like to look to is the Agency for Healthcare Research and Quality, Ahrq. It's a federal agency whose one of their primary jobs is quality improvement. And you can't improve what you can't measure. And so they do a lot of measuring about the quality of a healthcare system. And as you can see, Wisconsin, they've been doing this for a while, but the last 5 to 7 years, we've certainly never ranked lower than the top 10, and we've been in the top 5 most of that time. Very important. So how do we get there? Well, we focus very much on quality. In fact, this is our second annual healthcare quality report that we just put out a couple days ago, and it's been getting a fair amount of media attention the last couple days, talking about what's happening in Wisconsin. So I won't bore you with a bunch of statistics, but what this illustrates is very quantifiably some of the progress we are making in Wisconsin in reducing bad things that may happen in the hospital, hospital-acquired conditions, ultimately improving the output of healthcare delivered in the healthcare system. And now we're able to start quantifying what that means in terms of dollars. $87 million in avoided healthcare costs just from doing a better job at controlling the product that we're providing inside the hospital. Really positive news here, and something that I think in Wisconsin we don't shy away from. We don't avoid questions about quality or areas that we have to improve. In fact, we embrace those. We identify them, and we embrace them and we work on them. And I think that's another very strong attribute of a state like Wisconsin. We have a commitment to doing better and improving. And this is not lost on our state leaders. This is a quote from last year from Senator Leah Vukmir, a Republican from Wauwatosa, who is a nurse by training, a nurse educator by training, also chairs the Senate Committee on Health, and is also a part of the Budget Committee. Really pleased that we have our elected officials, people who are very much engaged in promoting the state of Wisconsin and strengthening the assets that we have in the state. So clearly, our elected officials are starting to grasp this message about health care and how we can channel it into economic development. A couple other things I'll talk about. What makes, in my mind and many others, Wisconsin such a leader in healthcare quality and ultimately healthcare value? And I think in large measure it's because we have such an integrated healthcare delivery system. Russ, you'd mentioned previously the fact, and so did Andy, that we have a very integrated delivery system. We have hospitals, physicians, many of the components of the healthcare delivery system sort of under one roof. And what that means is they're aligned. They're focused and they're aligned, moving towards a common direction. Does it always work that way? No. But when you're part of the same delivery system, approximately 80% of the physicians in Wisconsin are employed by hospitals or health systems. It's much easier to get everyone moving in the same direction towards a common goal. So we have that integration that facilitates care coordination, quality improvement, collaboration, and access. Absolutely crucial to improving, ultimately, outcomes for healthcare. We rank nationally, third nationally. We already talked about that. Community and employer collaboration to improve healthcare and manage costs. This is something I'll talk about. One of the greatest assets we have in the state, I think, is the partnership that is emerging and evolving between healthcare and employers. It's in many other states, including this state, not too long ago, I think the relationship between healthcare and the employer community was much more confrontational. But I think what we've seen, particularly in this state, and other states are starting to follow, is a common goal of managing healthcare costs. And how can the provider of the service do a better job with the purchaser of that service in improving that product and managing healthcare costs? It's something we take a lot of pride in this state, and something I think we stand out in. And then our previous speaker touched on this a little bit at the end. Sorry I came in with just 20 minutes left. It was an excellent discussion. In this state, healthcare providers, I think more than most other states, are embracing changing the way we pay for healthcare. Payment reform. And I'll try not to spend too much time on this, but I have to say, we could easily spend a lot of time on this, because starting, and this will sound odd, to people who aren't in healthcare, but starting to pay for the outcome as opposed to the components that went into the outcome will drive efficiency, will drive, for better or for worse, because I think there's going to be a little of both, will drive better quality and a more efficient delivery system. And in this state, we actually embrace paying for outcomes. You're not only seeing it in some of the federal government's work with Medicare, but I would say even more so on the private sector side. Some of the arrangements that are taking place between large health insurers and hospitals and health systems in Wisconsin are really setting the pace to pay for an outcome. And I'll just kind of leave it at that, as opposed to pay for each procedure. We're going to pay you, Hospital A, for how well you did, the type of care you provided. And whether that was that person readmitted, did that person have complications? Well, if they did, we're not paying you for that. We're paying you for the value and the quality of the overall care. That is going to drive a lot of the inefficiencies out of Wisconsin. And I think structurally, we are very well positioned in this state from a healthcare delivery system perspective to thrive in that new payment model. That's a great advantage for Wisconsin. You saw this slide already, but I think it's worth pointing out again. This is the Commonwealth Fund. It's a group that does a lot of, kind of like the Ahrq, does a lot of analysis of healthcare quality and value. Again, you're kind of going to start seeing a common theme. Wisconsin, along with some of our Midwest neighbors, really ranking up very high in terms of the quality and efficiency of our healthcare delivery system. This is an interesting slide. The Commonwealth Fund actually quantified, if every state in the country operated like those states that are white, this is what we could expect to see. 35 million uninsured and children and adults would gain coverage. 19 million fewer adults would skip needed care. 10 million more older adults would receive key preventive care. 1 million fewer Medicare beneficiaries, and that is a cost to us as taxpayers, Medicare. 1 million fewer Medicare beneficiaries would be prescribed an unsafe drug and thus incur complications and costly care as a result of that. 84,000 fewer people would die before age 75. 10 million fewer adults would lose 6 or more teeth. Well, that may seem kind of like an odd statistic, but it is a proven measure of the health of a population. So I put that up there because it does sort of show in numbers, just like we did with our quality report, what the effect, just on the general population, which of course has a cost impact, what the effect of delivering better care can have. Medicare is often a proxy for cost as we continue to get our arms around measuring in a valid way the cost of care in the private sector and the commercial sector. We often look at Medicare as a proxy for cost in general. And here again, Dartmouth has put out statistics on healthcare cost and quality and efficiency for quite some time. This is a measure of spending, severity, age, all those things that complicate the health status of someone is adjusted in this number. So it's a level playing field gauge. And what this says is Wisconsin is spending, half to a third of what some of the higher spending Medicare states are spending on Medicare. Now, that alone, I think, says something. But when Dartmouth went further, and they actually used quality metrics, kind of like the scatter chart we saw earlier, to actually put spending on one side and quality on the other. And again, unlike the last chart we saw where you want to be in the upper right, here you want to be in the lower right. So not only are we a low spending state for Medicare, but we're delivering a very good product. It goes to that efficiency discussion that we just had. So let me shift gears a little bit and talk about what this means. What does this mean for employers? What does this mean, if you believe me, that we have a high quality, high value healthcare system, what does that mean for employers in the state, and what does that mean for future or potential employers in Wisconsin? Well, one measure of this is our workers' comp program, which is getting a lot of attention lately, and probably welcome attention. But this is, we can look at workers' comp and really use it as a gauge, and in some ways proof of what I've been talking about earlier. So in workers' comp, better quality of care means less utilization of services. We're getting people, injured workers in this state, getting them in and out of the healthcare system much more efficiently and without a whole bunch of added services that they don't need. And that bears out very, very clearly in the data that's there comparing us to other states. A very low number of average visits per claim in workers' comp, and a very low number of average services, actual things that are done, healthcare things that are done to an injured worker. A really good measure of this quality, and healthcare isn't the only piece of information, or the only component of this data, but how long is an injured worker out of work? And in Wisconsin, we return injured workers back to the workforce, back to productivity, faster than any other state in the country. Now, if I'm an employer, and we know this from the survey that we did, I'm interested in productivity. I'm interested in things like absenteeism, Using workers' comp as one measure, we know that we get folks back to work faster and back to being productive faster than any other state in the country. And then medical costs, the medical spend associated with a workers' comp claim in Wisconsin, well below the national average. Point being, we're delivering good outcomes and we're doing it in a very cost-efficient way. In fact, this is almost a year old now, but this really caught my attention. And there's a lot of factors that go into workers' comp, and many of you know that probably better than I do. But this is sort of an illustration of what I'm talking about. Healthcare as a component of that decision on where an employer is going to locate or grow or move. And this is out of Governing Magazine, which is led by a magazine that's read by a lot of policymakers, basically talking about an employer, the sort of woes of New York and what they're going through, and citing specifically workers' comp as one of the reasons they came to Wisconsin. The other thing I think that's very positive about our state, and I mentioned this earlier, is the partnership that exists and that is growing between healthcare providers and employers. I think it's a real asset we have in Wisconsin. And these are just a few of the examples. There's many, many more. But these are kind of marquee names of some of the relationships that are going between healthcare systems and hospitals in Wisconsin and major Wisconsin employers. On-site clinics, wellness programs, working to minimize workplace injury that are intended to keep people healthier, keep people more productive, and ultimately reduce the increase in healthcare costs. Very, very positive about Wisconsin. This is a good example. There's a group in Milwaukee, some of you may be familiar with it, or based out of Franklin, the Business Group on Healthcare. It's an organization of large employers, sort of all organized around for the purpose of driving improvement in their healthcare and their healthcare costs. And they've been doing some very innovative things. I talked about payment reform, and they've just recently entered into a new relationship with United Healthcare to start paying more for outcomes and value as opposed to volume of services. But we really like this. Diane Keel is the executive director of the Business Group on Health, and she made it very clear that one of the ways that the business group has been so successful is by partnering very closely with their healthcare providers. And they release a report every year that talks about this. And this speaks directly to the efficiency issue as well. Milliman does this analysis for the Business Group on Health. So respected analytics. From 2003 to 2013, the average, and it's focused on southeastern Wisconsin because that's where the business group is located, and that's where their providers are, or their employers are. Southeastern Wisconsin hospital operating costs increased a total of 19%. So that's less than 2% per year. Operating costs increased less than 1% from 2009 to 2012. The reason I put that up there, and the reason that was in the Business Group on Health's report, is it's a measure of efficiency. It's showing that healthcare is moving towards delivering that care in a much more cost-effective way. But that's great. But what does it mean, and how does that translate to the purchasers of healthcare? Same report, same period of time, increase in average southeastern Wisconsin hospital commercial payment was 37%. That's over that entire period of time, which is half the rate of the hospital CPI, which is at 75%. Total increase for 2009 to 2012 is just 3%. So the point here is providers, as measured here in southeastern Wisconsin, where most of our employment is, but it's certainly not the only gauge for Wisconsin, are doing a better job of controlling their own costs. They're doing a better job of producing a better quality product by controlling their own costs. And that is reflected in the cost of hospital care for those employers. We are also a partner with our employers on transparency. We believe in an informed consumer. I came in on the tail end of the last presentation, but my guess is it spent a lot of time talking about the emergence of the consumer in healthcare, and I think we're actually finally there. Now, I think the cart is catching up to the horse when it comes to actually producing an engaged consumer in healthcare. The hospital industry in Wisconsin has been way ahead of the curve on transparency. And now we think that the consumer is starting to catch up. So we've been not bashful at all about making prices, the retail price for hospital care public, and putting that in a very accessible form on our website that allows comparisons. We've been doing this for a long time. In fact, 15 or 16 other states are now licensing this website, if you will, for the same purpose. But it's not just price, and this is not perfect by any means. As the consumer evolves, we need to rethink what transparency really means. But we're ahead of the curve in this state, I think, certainly along the way. But it's not just price, it's also quality. And for the last 10 years, WHA has been producing very understandable, consumer-friendly data that gives you a sense of the quality of care in our hospitals across the state, and in a very comparative way. In fact, Checkpoint was the first voluntary quality measuring system in the country. And the beautiful thing about it is it's darn near every hospital in Wisconsin. And it's not just the big hospitals in the urban areas. All of our hospitals. You talked about the spread of hospitals across Wisconsin. One of the things about this state that's so great is the commitment to quality. From the smallest 25-bed hospital to some of the largest hospitals in Milwaukee, they're committed to doing better. And publicly reporting, not hiding from it, publicly reporting quality data is a great example of that. You cannot improve what you do not measure. And that's something we buy into 100%, that you don't measure and report. And not just saying, yeah, we got a website. We actually push this out to Wisconsin employers. These are the front and back of some direct mail pieces that we've done. We have a list of over 2,000 employers in Wisconsin. We sent these out last year. We want employers to know what we're doing. We want employers to be engaged with us and to be a partner with us on improving health care. And transparency is a big part of that, and that's why we sent that information out. We're not the only ones talking about this. I do really believe that that health care is an asset for the state. It's a part of our infrastructure, our economic development infrastructure, if you will. And again, I'm not talking about jobs in health care. I'm talking about it's just as important as roads. It's just as important as education. Employers told us that in our survey. It's just as important as utilities, or it should be. And it should be for a state like Wisconsin, because we have a lot to tout and be proud of in this state. We're not perfect. In fact, one of the best things about us is we know we're not perfect, and we know that we have to keep doing better. But this is, the governor has picked this up. You know, the state's greatest champion has picked up this message of high-quality health care being one of the reasons to come to this state. And we're very, very happy with that. And it's not just the governor talking about Wisconsin. We've been getting a lot of national press, and not in healthcare magazines. These are business, you're probably all familiar with some of these publications more than me. Area Development Magazine, Site Selection Magazine, WMC has been talking about it in their magazine. We're really happy with this. In fact, until recently, other states were talking more about the quality of health care in Wisconsin than Wisconsin was. And that's sort of evidenced by these articles. But that's starting to change. We're very, very pleased with our partnership with the Wisconsin Economic Development Corporation. WEDC has picked up this message. That's an article that appeared on their, it's a lot longer than that, but article that appeared on their website not too long ago. And this is actually Unparalleled Healthcare is part of the WEDC's marketing material now about Wisconsin. So I'm really, really happy that this is a message that's starting to be picked up, because it does matter. And then last thing I'll say is we've been pushing this now for a couple years at WHA, and we're looking for partners. This is a website we created, Wisconsin Healthcare Ahead of the Curve. It's all about quality and value and the partnerships that exist here and why those are positive and why those are important for someone who's looking to grow a business and hire more employees. And hopefully this will be one of the reasons they look at Wisconsin. So from just a couple little tidbits of information, if you're looking for more, Mary Kay Grasmick, who's our Vice President for Communications, is sitting right there. And we're happy to help you learn more about this, what we're talking about. We're easily findable. We're located in Madison, but you can get a hold of any of us in many different ways. So thank you very much.
Thank you. We do have some time, a few minutes for questions, and I think you already answered a question I had, which is we talked about partnership between employers and healthcare providers and the hospitals. Obviously, the WIDA members have easy access to the employers in their area. WHA has its hospital members, and my question was how could the economic development professionals best get in touch with WHA to start building that case for their existing employers and for business attraction. And I think the contact information you had, is that the answer, or what's the best way?
We're very easy to find. And we're not bashful. We want professionals who grow business in the state. For your partner, we need you, you need us. So I contact Mary Kay, go to our website, we've got a lot of stuff there, or of course, work with your local health systems, because they're all bought into this as well.
Questions? For Ahrq or Russ? Are you all anxious to hit the road? Well, we'll be sticking around for a little bit after the session, so if there's people that want to ask questions afterwards, we'll be available. I think Christian's going to provide some wrap-up details, but thank you again for your patience. Thank you, Russ and Ahrq, for joining us today.
Fascinating. I wasn't sure what to expect from the healthcare session, to be completely honest. I recognize I'm the only thing standing between you and a weekend coming up here, so I'll be very quick just to point out that on the back of your program are several upcoming trainings. The facilities where these trainings are at are amazing facilities, but those hotel rooms can fill up. Please be sure to check those out on the WIDA website, and if you have any interest whatsoever, many of them you can already register and book out. The couple of new ones that are coming up here are the first annual summer golf outing, as well as the Community and Economic Development Awards. It's going to be a great time to celebrate some of the good things that are going on here. Also, the spring event is extremely expensive. That is to say, it's free. So please take advantage of bringing out as many folks as you can that might be interested on the lending and financing side. As we heard this morning, change is permanent, but progress is optional. And I think you can see from what's transpired over the last few days that WIDA has definitely made its choice on that and is working towards progress. As it relates to how you can contribute to that, there's really no reason to have a scarcity mentality when it comes to resources here in the state of Wisconsin. If we work together, if we foster the teamwork that WIDA is all about, we aggregate demand and we combine muscle. And by the way, we mean by that not just inside WIDA, but pulling in from outside WIDA, as you heard about maybe in terms of the Memorandum of Understanding with the League of Municipalities. We have the resources to be a leader here in economic development. And last but not least, it's about attitude as well. And that's one of the exciting things that I've found that differentiates Wisconsin, just in some of my experience in economic development. WIDA is making a commitment to you to continuously improve the way that we leverage development assets across the state for your direct benefit. My question to you is, how will you commit to our profession and helping WIDA enable that success? The conference showed you how we're working to advance and how you're working to advance communities on a very large stage. And indeed, just listening to some of the healthcare information, we are on a large stage and we've got something to boast. Let's lead. Thank you very much, and safe travels.